Chapter 55, Titanium Implant Loss and Genetics. Alright, once you have lost a tooth through periodontitis or through some other reason, a common solution is a titanium implant, and that looks like this. It's basically a metal screw made out of titanium, and it is screwed into the bone, and an artificial tooth is attached to the top, and so it looks like a normal healthy tooth. And this is actually a quite difficult procedure. It takes ages for the bone to heal and before you can attach the tooth. It can also be quite painful. But once it is done correctly, it's usually a very good way of replacing lost teeth. Now, there are genetic variations similar to periodontitis which modulate the aggressiveness of the immune system again. And these can attack titanium in some cases. It's actually small titanium shavings that end up in the tissue, but the immune system starts to attack them and starts to do the same as in periodontitis. It degrades the bone, and eventually, usually within quite a short time, you start to lose your titanium implant. And that's a very expensive and very painful procedure, and you would want to avoid this at all costs if that is possible. And we now have a number of genetic variations that we know contribute to the likelihood of titanium implant loss. So depending on the number of genes, and there are 5 genes which play a role in this, all 5 genes might be of the optimal type, so no increased risk, or all 5 genes might be of the increased risk type. And this is what you have. If all of the genes are of the optimal type, you have an approximately 3% risk of losing your titanium implant. If one of the genes is of the risk type, it's a 25% risk. 2 is a 26% risk. Up to 5, so all 5 genes are of the suboptimal type, you end up with 60% risk of losing your titanium implant. So it's more likely than not that you will lose the implant. And in these cases, there are a number of other things like ceramics or some polymers, some kind of plastics that you can use as an alternative metal. So what we recommend is you do the periodontitis test. You find out that your risk might be 3%, so you can go ahead with titanium, or you might find out that it's 60% likelihood and you should go with a more expensive, however, a better material for your body and for your immune system. So titanium implant might not be suitable due to genetic predispositions, and you might have a 50% probability of losing it, and you should use an alternative such as ceramics, plastics, or coated titanium that will help. And again, it's explained in a very simple language, so when you have the report, you should read through it once and you will know what kind of things that we would recommend. That's the end of chapter 55, Titanium Implant Loss and Genetics, as specific training for the periodontitis sensor.